Hello, everyone. Welcome to this live session on the YouTube. I'm thankful to FirstCry Parenting for giving me this opportunity to interact with you people. I am Dr. Manish Saxena. I am a consultant pediatrician and pediatric cardiologist. Been working in the field of pediatrics for past 15 years. And today we'll be sharing our thoughts and my experiences about what to expect after a baby's vaccination and how do the parents deal with the pain and the other issues relevant to a baby's immunization. So without further ado, so immunization is the most common reason now that parents are visiting their pediatrician. Uh, First-time parents or even they have lots of doubts and about how to go vis-a-vis the different vaccines and what to do with the child once the vaccine is done. Or so, first thing I want to say is vaccination are one of the most safest and one of the most effective methods which is available to to pediatricians, which saves small babies from a plethora of very dangerous diseases. And we must be thankful to this to the people who have developed those vaccines. So our infant mortality, like the number of children who are dying with these severe diseases, have considerably come down because of these vaccines. So these are very effective for prevention of these deadly disease. They're very efficient and but like all things, these are not always 100% safe. Though they are very safe, the adverse reactions are far and few, but they are there. So as a parent, you should be aware of certain things, and whenever in doubt, you should always doubly ask your pediatrician when you are getting your child for vaccination. So most commonly, the vaccination, the bulk of the vaccination happens during the first year of life, right from the birth, then going at around 1.5 months, 2.5 months, 3.5 months of age, and then so on and so forth. So various vaccines are given at various points in the child's life, and most of these are very safe, but some of them are more common to cause generally mild symptoms and very, very rarely very severe adverse effects. We will not talk much about the very severe adverse effects because they are very, very few, maybe like 4 to 6 per million dose of any particular vaccine given. So we won't go much into that because it's more of for people who are medically who are into medicine and they see a lot of these cases. But for general public, I would share some thoughts. So right at the birth, one of the vaccine which is given is called as the BCG, which is effective against tuberculosis to a certain percentage. This is given on the left shoulder, underneath the left shoulder. So it's an intradermal vaccine, which is generally given in the hospital setting once the child is born. I mean, within the first few days of birth, generally on the first day. So this is quite a safe vaccine. But what happens is when this vaccine, there develops a papule, or you can say a small boil kind of a thing, which then ulcerates. And generally parents are worried. They call up me, or I mean their pediatrician, key such and such thing has developed. So that's a very common phenomena with BCG vaccination. If you yourself see on your left shoulders, you'll have a small scar. So this BCG, the natural course of this BCG vaccination is there will be development of some small papule, and then it will ulcerate, or there would be some a very minor wound kind of a thing, and then it will scar. There will be formation of a permanent scar, which you can also see on your left hand. So this formation of small papule is a normal finding and shouldn't be worried about. Beyond that, the bulk of vaccinations which happen at 6 weeks, 10 weeks, and the 14 weeks of age, there are multiple vaccines, multiple diseases which are covered, right from polio to diphtheria, pertussis, tetanus, pneumococcal disease, and rotavirus diarrhea, H influenza type B. H influenza type B. So these are so a lot of these in the initial, because this would be the first vaccination of the child. Parents are also quite apprehensive, and a few of these vaccines are known to have some adverse reaction. Generally, the DPT component, the pertussis component, these vaccines are prone for some kind of adverse reaction more commonly. So generally, the reaction, adverse reaction at the 6, 10, and 14 weeks are localized reaction. Localized reactions are like confined to the place where the vaccine has been given. So generally, there would be tenderness or redness, or there can be mild fever, and there can be episodes of crying which may last for a bit longer, maybe an hour or two. So these are commonly we see these adverse effects. So these are nothing to worry with these. We can just apply cold cold sponging can be done with ice or something, so as to soothe the area where the vaccine has been given, and a dose of antipyretic medicine, generally the paracetamol, whatever the brands your pediatrician is advising, you can give that a dose of paracetamol, and that would suffice. Then these adverse effects generally last for a day or two, and after that it subsides. And with the subsequent doses, these local reaction might be more pronounced at the 10th and the 14th. The second and the third dose may be a little bit more pronounced than the first, and the serious side effects are something called as HHE or a seizure, or those come down with the subsequent dose, but that's generally not observed, these rare adverse effects. Beyond these first few months of immunization, there would be some influenza vaccination, which would be given for an infant at around 6 months of age. These are also associated with the similar minor side effects of mild fever or a tenderness at the local site. So you can just do cold sponging and cold fermentation using ice or an ice pack. You can use that, and that generally suffices, along with a dose of antipyretics. Beyond 6 months, there will be at 9 months of age, measles vaccinations would be given. Generally, it is given in combination of measles, mumps, and rubella. This generally also has a minor side effect, which may be confined to 1 or 2 days. But more importantly, because measles is a live vaccine, it is actually measles, but which has been toned down so as to induce an immunity but doesn't cause an illness. So it might cause a minor measles-like symptoms, maybe 7 to 10 days after the immunization has happened. So this would be a fever, or a mild degree of rash will be there. So it generally giving an antipyretic generally suffices, and it's self-limiting, and then it doesn't last for a long time. But be aware that even after measles vaccination, even if immediately nothing happens, you might expect that at the end of a week to 12 days, there can be some degree of rash or fever, but you need not to worry about it. These are self-limiting things. Uh, Once these are done, then there are other vaccination like typhoid, chickenpox, hepatitis A, and the booster doses of the vaccines which were given previously. So these are generally quite safe and don't have many severe adverse reactions, and they can be managed at home without any. We don't need to worry about them. It's just antibiotics and all which is required. Uh, I think that is it as regards to how parents deals with the um, patient, baby who has been vaccinated. One small thing in a very small baby, like 1 to 3 months, or even 6 to 8, 9 months. So immediately post vaccination, if there are no oral vaccines are not given, I generally it's my dictum. Generally, I ask the mother to feed the child, because anyways after vaccination we ask them to wait in our hospital or clinic wherever we are, to wait for half an hour to see any adverse event. In this, that's the time immediately there would be pain, and if there are any severe adverse reaction that are there to happen, they would happen in the first 30 minutes. So we can have we can keep an eye, and if the child is fed during that time, uh, generally it's quite soothing, and the needles that are used, they are quite small, so they have a very transient pain as vis-a-vis the injection pain. The pain later is due to the effect of the vaccine itself, but immediately at the point of giving the vaccination, that needle pain, it lasts for a small length of time, and at that point, at the time, I think feeding generally helps. So that's what I follow. There are some people who would use some local sprays, and that's an individual choice. So it kind of numbs the area, or you can distract the child with a toy or something, and immediately the doctor gives the vaccine, and child doesn't even know that what has happened. You might have seen such videos on YouTube or Instagram Reels or whatever. So the immediate pain issue is not much of a concern, but still the child be comforted given by giving breastfeed or by distracting him with a toy or something for the time being. Um, I think that is all I have to say, more or less. Then I can go for the questions. Okay. So the first question is: the vaccine available in public hospitals are adequate for a child, or we should stick to private hospitals only? So, so the government gives the most important vaccines because they have a large population, and whatever they think, which is the which provides the maximum benefit to maximum number of people, with a cost that can be done from a government perspective. So yes, so there are mostly DPT and oral polio vaccines, and even now some states are giving pneumococcal, Hib. So those are good, those are sufficient, but they generally do not cover all the diseases. Some of those diseases are mild, like hepatitis A is a mild disease in children, but sometimes it can be a severe form of disease. Varicella zoster chickenpox is a mild disease, but they can have adverse reaction which are rarely very difficult or very ominous. So as I said, if you can afford, you should take the additional vaccines, or you can go to the uh, government facility, get the basic vaccination, but then you also need to be in contact with your pediatrician, what else can be given, and then take a decision based upon what your pediatrician says and what do you think of it. Okay, so that is about the public and private. Can I do my immunization at home? No, you cannot do I mean, you cannot give a baby the vaccine. There is a particular technique, and uh, by which vaccine is used. There's a particular site. Can I do I mean I really don't understand. Can I do my baby's immunization at home? I really don't know what exactly is meant by. If you are a doctor, then maybe, or your healthcare worker, then maybe if you have been trained, then. What are the adverse effects on vaccination? So generally, pain, tenderness at the site of injection, sometimes fever, vomiting, and decreased appetite might happen because of pneumococcal vaccination. These are mildly symptomatic and generally last for a day or two, and they can be addressed with the prescription drugs which your pediatrician is providing, generally paracetamol or a Domstal syrup would do. After vaccination, what to do for the bump that appears? So the bump will generally, there is no bump in a intramuscular or even a subcutaneous injection. The bump I think you're referring is what happens when there is a slight tenderness or swelling at the site of infection, site of injection. I'm sorry. So that thing you can just use ice packs to compress, and that will be fine. And that only lasts for a day or two. Please tell schedule also of all the vaccines. Well, there are apps available on everyone now carries a mobile. So there are IAP apps for immunization. I will, so there is an IAP, Indian Academy of Pediatrics. There's an app which anyone can download where you can find all the immunization scheduling. And if I tell you, it will be, you wouldn't remember, but having an app, and then at the time of birth, you would be getting some form of an immunization card, and you can just go through that as well as this app, and you would find all the vaccines which are given, and then you would be consulting with your pediatrician regarding the nuances of each vaccination. Should I give my 9-year-old daughter diphtheria, tetanus, polio, parotitis, mumps, rubella vaccination? Well, if nothing has been given till now, which I do not, if by 9 years of age DPT has not been given, then there's something called as the catch-up immunization, where a different kind of a DPT, which has the low dose of there will be acellular pertussis and diphtheria toxoid. That's a different combination which is given generally beyond 6 to 7 years of age. That is used. Measles and rubella vaccine. Now we have only combination of vaccines which is generally available in the private sector. Measles, mumps, rubella, those can be given after consultation with your pediatrician at the given schedule. How do I know which vaccine my child needs? Okay, so if you're following it up with your pediatrician regularly, he would generally mention in the immunization card what all have been given. You can see, basically you have to have a record maintenance. If you have a file where you from and then I have mentioned about this IAP app, so you can know, you can yourself jot down at what age what all vaccines are needed, and when you visit your pediatrician, he would write it down. Okay, this particular dose was given on this date, and that's how you would know which vaccine your child needs. What are some of the most common symptoms that babies experience after being vaccinated? I have told you. So generally, transient pain because of the stab of the needles stick, and beyond that, there can be some tenderness, redness of the area because of the vaccine effect itself. Rarely can be diarrhea, or vomiting can be there, or there can be, baby might not feed as much as he or she was feeding previously, for transiently for a day. Beyond that, the very rare adverse effects, those are generally of interest of medical personnel. There can be seizures, there can be something called as HHE or encephalopathy. These are very one in a 2 to 3 per million doses, generally not very commonly seen in our practice. My 5-year-old son has low level of immunity. What can I do to boost my baby's immunity? There are no immunity boosters as generally a healthy diet, a wholesome diet which encompasses all the nutrients, proteins, carbohydrates, especially vitamins. Take a lots of green vegetables and fruits in the baby's diet. And I really doubt what is the low level of immunity. I think you have assumed because the child may be having a cough and cold or something regularly, you feel that the child has got low immunity. Please bear it in mind that the childhood phase is the phase where we tend to acquire immunity after getting exposed. So there is something called as natural immunity, and then there is what is derived by the vaccines. So natural immunity is generally by plethora of viruses and all, where the child catches them and then develops immunity to them. We give vaccinations for diseases which are very bad, in the sense if they are either they are not treatable or they have a very severe course if the child happens to catch them, and therefore we give vaccination either so as to, with the vaccine are attenuated forms of, attenuated means some they have been modified by the processes so that they just induce the immunity, don't and do not induce much of the symptoms. So that is it. What is the schedule of child vaccination in Gurgaon hospitals? In Gurgaon Government Hospital, the schedule is very much the same. Like at birth, then 6 weeks, 10 weeks, 14 weeks, 9 months. Uh, uh, but the vaccines they are giving, like for example, pneumococcal, we are giving 3 doses at 6, 10, and 14, but they tend to give only 2 doses because they feel that it is sufficient. Some of the data shows that it is sufficient, but there are different bodies who come to such decision. IAP recommends, Indian Academy of Pediatrics recommend 3 doses of pneumococcal in the primary vaccination, and then it's booster between 15 to 18 months. So government schedule, you if you're going to a government dispensary, they would provide you a card, and there it will be mentioned and what all vaccines are given, that can be done at the government center, and you can contact your pediatrician or even online resources, the IAP app, and you would come to know what all are missing, what all you need to take. My baby is refusing breastfeeding after vaccination. It had been a month ago. I doubt this is not something which can be attributed to the immunization. Uh, it has to do with the technique, or you have not mentioned what is your baby's age, how much, what is the age of the baby. So that you have to contact your pediatrician or there are feeding counselors who would help. But immunization has got nothing to do with the refusal of feeds. Private or government, which hospital is better for vaccination? So both, see, vaccinations are very standardized products. So wherever you take, either in a private hospital or in a government settings, the quality of vaccines is top notch at all the places, because these are tightly regulated products, and you can trust on them. The only difference lies is all the vaccines are not available in the government hospital, and whatever are missing you can take in the private hospital, so that is fine. But there is nothing like government would be better or a private would be better, because all these vaccines are produced in a very particular environment. There are strict controls over manufacturing, and quality controls are there. The cold chain is to be maintained. So the vaccine, the center doesn't matter, but what all vaccine are missing, and there are some vaccines which are for special population, They are not generally available with the government sector. What is the chance of child if unvaccinated? I don't think we should ever take that chances. What are the chance of developing a disease if unvaccinated? So if there is an injury and your child is not vaccination for tetanus, and a severe injury, and you still do not take up tetanus and child develops tetanus, then there is nearly 100% mortality. So I don't think, and I I would strongly recommend people should not take up think this what are the chances. I don't think we should take chances with such severe diseases, just to check, okay, what is the chance my child will get a tetanus, what is the chance my child will get a pertussis or diphtheria. Your child can get paralyzed, or there can be heart failure if there is a disease like diphtheria. So these are disease specific, and each disease which are covered by immunization are many of them are really ominous, and we don't want our child to suffer from that. So that's question. You should not bring this thought. Is there a choice for child's pain-free vaccination using a needle? Well, not all the vaccines are available. Few of the vaccine like rotavirus and the oral polio vaccines, they are oral. They are vaccines which can be given orally. But beyond that, most of the vaccines would be injectable. The reason being these are viruses or bacteria, so they have to generate an immune response. Immune response is generally generated when an organism, a microorganism, pathogen enters the is encountered by the blood cells. There are specific immune blood cells. They have to get exposed. When the pathogen is exposed to these body immunity cells, then the body generates an immune response. So if something is taken orally, then it will get digested. Our stomach has got acid and all, so they will never be exposed, and the immunity will not develop. So that's the way it is. Uh, the, the pain of a needle or an immunization injection is much less than the pain a child or the parent would encounter if he develops this disease. So besides a couple of vaccines, oral vaccination or a nasal vaccination, now they're thinking about some nasal vaccination for COVID. So these are far and few, but by and large, all the vaccines are injectable vaccines. Are there any questions more, or we can conclude this session?